We're good to go? Wonderful. Well, good morning, Queensland. It is a wonderful day. It is double donut day again, so 0 new cases for Queensland. We are at 17 active cases. Thank you to everyone who came out and got tested in the last 24 hours. We've had 13,036 tests and a record daily number of vaccinations, 23,012 vaccinations yesterday. So well done to all the Queenslanders coming out and getting vaccinated, and well done to all of our health workers and other staff and volunteers who are working at all of our clinics. That puts us at 53.76% have had their first dose and 35.22% have had their second dose. So over 35% of eligible Queenslanders are now fully vaccinated. So that is great news, and of course we'll continue to see those numbers go up. Because of the wonderful outcome of the negative test in relation to all of the close contacts so far, and that all close contacts are now in home quarantine, the good news is today we can announce that the restrictions on visitors to hospitals, aged care and disability facilities in the Logan local government area will be lifted immediately. So you'll be able to go visit your loved ones again. We'll still have requirements around masks. Of course, the masks are still required anywhere indoors anyway, but of course it is great to be able to let people go visit their loved ones in hospital and aged care and disability facilities again. So well done to Queensland for coming out and getting tested and doing the right thing. Again, to all those close contacts, particularly those young children and their families, thank you for doing the right thing and quarantining at home for those 14 days, because of course, even though they got a negative test when they went in, we know that they could become positive, but in doing so, they're keeping the community safe by staying isolated. The other thing I want to talk about is the reports today around the ADF coming into Queensland. Can I clarify this for everyone? These reports are inaccurate. The facts are this. Last Friday, the ADF, in addition to their normal ADF arrivals within the cap going into hotel quarantine, made a request that they had personnel up to 400 wanting to come to Queensland from Afghanistan, and that they were wanting to enter into alternate arrangements for this group. Those alternate arrangements being a bubble arrangement where they can move more freely for their health and well-being within a quarantine arrangement in a hotel. They made that request last Friday. They advised that the ADF personnel would be arriving on the 10th and 11th of this month, so Friday and Saturday. So they said that on Friday, that they weren't due to come back till Friday or Saturday. Over the weekend, we have worked through all of that. In fact, the next day, the ADF received an email from the Chief Health Officer confirming her in-principle support for entering into arrangements like that and outlining what we needed to do to secure facility and also to set up a Queensland management plan. In fact, that afternoon, the ADF sent an email back saying thank you so much for our support and working with them. And on Sunday, the ADF provided us with their timeline and plan. That timeline was that on Sunday and Monday, the ADF would look at facilities suitable to quarantine in, that on Tuesday they would secure that facility. On Wednesday, being today, they would provide a Queensland management plan to Queensland Health and hope to finalise that plan by tomorrow, with the ADF personnel arriving from Friday. That's 360 personnel above the cap who will be coming back. That time frame is agreed to, and it's the time frame we've all been working on. So these reports today that there was either a rejection or no communication is completely false. I think it's very mischievous. I don't believe they're coming from the ADF. In fact, I think the ADF would be quite concerned about these reports, knowing that we've been working so cooperatively over the last 5 days. And I think it's distressing for the families and for the ADF personnel themselves to think that there was in any way doubt that they would be able to come back to Queensland as planned within the timeframe of the ADF. So we were asked with about 5 minutes notice last night about this story. We provided the information that we had at that time, stating that as far as we were aware, they were coming back, they were allowed to come back. So it is distressing. It's distressing that these false claims have been put out there. It's distressing for the ADF, it's distressing for their families, and it's distressing for health and the government to see these reports that are completely inaccurate. And I want to thank the ADF, who have worked with the Chief Health Officer and the government, not just in the last 5 days, but over the last 18 months that we've been dealing with this pandemic. And it's been a very cooperative relationship. In fact, the Chief Health Officer met with the ADF on Monday afternoon. At no point has anyone raised any concerns with the proposed timeframe and plan laid out. There's been no delay because it was the ADF themselves who said these personnel would be arriving on Friday and Saturday. I've heard some comments from some Commonwealth Government ministers from the Morrison government this morning on radio. I find those comments appalling, considering those ministers are not aware of any of the facts. And the fact is that not one Commonwealth minister has reached out to the Queensland Government, to the Premier's office, to my office, to Queensland Health, to verify or raise any concerns in relation to these ADF personnel coming. Not one. I've put in a call to Peter Dutton. I wasn't able to get through. I've sent a text to Peter Dutton this morning asking him to call me. I have not heard from him. So before the Commonwealth gets up and makes public statements criticising the Queensland Government, which seems to be their modus operandi now, that's all they do, go out and criticise Queensland, great deflection on anything else happening in the country, then make sure they've got the facts. Because we're a little bit sick of the Morrison Government coming out and attacking us on vaccines, attacking us on ADF personnel, and seem to be just deflecting on their own failings right now. So we expect, and the people of Queensland expect, a lot more from the Morrison government, and it's about time they stop playing these cheap politics. I'll hand over to the Chief Health Officer to talk about our great zero cases today, and we'll take questions. Thank you.
Thank you very much, Minister. Yes, that is excellent news. So no new community cases. So that Boondall cluster now sits at 3 people, and I'm confident that we've found the vast majority of the people that we needed to find. They're all now in quarantine, and so far, except for the original 3 cases, of course, they've all tested negative. So as a result of that, I believe that it is safe for us to reintroduce visits to aged care, hospitals and disability care services within that Logan area that was stopped when we had that risk of an evolving cluster. So that's all excellent. Now, we've got that cluster under control. We've got our original Indooroopilly cluster now well and truly under control. But I don't know when we're going to get our next outbreak. Due to the fantastic work done by Queenslanders each and every single time, we've been able to manage all of these different outbreaks. But we need to be prepared, and the best way to be prepared is to do what everyone is behind me over there, getting vaccinated. It is absolutely critical. So please, would people go online and look at which GPs? There are 341 GPs in Queensland today, and more coming online every single day, who can deliver both the AstraZeneca and the Pfizer vaccine. So make sure you find who they are, and if it's your own GP, and from Monday next week, if you're 12 through to 59, you can get Pfizer. If you're 60 or over, AstraZeneca. This week, 12 to 15s, it's only if you've got underlying health conditions, but from next Monday, any 12-year-old or older. So it's really important. See if your own GP is offering Pfizer. Look at your own pharmacy. So they're going to very soon be getting Moderna, which is very similar to Pfizer. Then, if you can't access those, or it's easier for you to access, come to one of our many mass vaccination centres that we've got stood up across the state. So just check their hours. Some of them are going to start offering walk-ins as we find that the bookings tail off. At the moment, we're finding most of our centres 100% booked. So there isn't room for walk-ins, but as soon as we start seeing any capacity, because we get more vaccine, so we can open up more spots, we'll be offering walk-ins. So, but don't wait. Just as soon as you can, find where you can get vaccinated, because that is the best protection for when the virus does come into Queensland and start spreading. Thank you.
And as Dr Young said, we're here at the Brisbane Entertainment Centre in Boondall. 1,500 booking slots are already filled today, and we will move to 3,000 each day from next week. And we have the capacity to expand much greater than that when the supply arrives. So we're looking forward to all of those vaccines coming and knowing when we will get sufficient supply that every Queenslander who wants to get vaccinated will be able to get vaccinated. Questions?
Greg Hunt claimed yesterday that there were 60,000 doses of Pfizer that hadn't been ordered.
Look, I heard that report as well, and if there's 60,000 on offer to Queensland, we'll take it. The Director-General, and hearing those media reports yesterday, immediately got onto the phone to the Lieutenant-General, JJ, and said, we'll take it. So I'm hoping that they'll arrive tomorrow, and we'll make sure that they get into arms as quickly as possible. We weren't told there was 60,000 available to us to order. So this is the games that are being played right now. If there is 60,000 there sitting for us, we've been calling forward our future supplies constantly. So to find out there's 60,000 there that we could order is great news. We welcome it and we want it. So I look forward to Greg Hunt delivering it tomorrow, because last time he stood up and said there was vaccines there for us and we could get it immediately. I wrote to him and he said, well, actually it's not additional stock, it was what you've already asked for and we're delivering. So I'm a bit tired of the rhetoric and the stunts. If there's vaccine there, give it to the states.
So they say that Victoria has ordered 100% of its doses and Queensland hasn't.
Queensland, can I be clear? Queensland Health has ordered 100% of its doses. Now, there's other doses. There is almost the equivalent Pfizer doses going to GPs. I understand the GPs aren't ordering 100% of theirs at the moment. And I, talking to the Chief Health Officer yesterday, was aware that some of the stock that was sitting there for GPs that haven't been ordered by them, that we have been asked, do we want it? And we said yes, and we're getting it. So, let's be clear. If there's extra stock, we should be getting it. Now, Greg Hunt has said overnight that yes, New South Wales got per capita extra, and that we have, and Victoria and Western Australia have received less per capita than what we're entitled to. He also has said overnight that we will get our catch-up supply in November. Now, how does Scott Morrison expect us to meet our 70 and 80% targets in October if we're not going to get our catch-up supply to November? I am very concerned that we're hearing that our supplies will be October, November, December. That's dragging us out to Christmas. We need our supply now. The Morrison government stood up at the start of the year and said, come October, we'll get the big supplies so we can get the population done. So they need to stop playing politics. If they've got vaccine, we'll take it, and stop announcing these things through press conferences and start actually communicating with the states as to how much they've got on stock and get it to us.
So on that communication, the federal government says that they send a form out showing Queensland's allocation. Queensland Health sends back a form ordering it, and Queensland Health Queensland Health has ordered everything is available to us. We only get notified of how much supply is available in about 4 week lots. So we don't know what's coming in October, November or December yet. We get 4 week blocks and we get told this is what is available to you, and we take it. Now, we've also seen the Commonwealth stand up and say, and we've got them coming from Poland, we've got some supply coming from Singapore, we've got some supply coming from UK. So those figures are changing
almost daily now from the Commonwealth, and we have to play catch up because we plan for this much and suddenly we find out the country's getting more. We don't know what our supply is. We don't know if it's coming to Queensland Health. We don't know if it's going to GPs. We don't know if it's going to pharmacists. So there is a lot of information that needs to be shared quickly by the Commonwealth so we can plan and rapidly escalate. We are ready. It is Queensland Health, it is the state government that's setting up mass vaccination hubs. It is Queensland Health that is travelling right across this very vast state delivering to remote communities. It's not the Commonwealth, it's us. We're carrying the workload here in vaccinating our community. We just need the vaccines and they need to stop playing politics with this.
Are you saying some or all of that 60,000 is due to GPs not ordering their full allocation?
We're trying to find out where this 60,000 is from. We were aware that there was about 20% of the supply set aside for GPs that GPs hadn't ordered and that we were being offered that. So we said yes. But this 60,000 we knew nothing about till yesterday. And in fact, our Director General, my Director General, picked up the phone yesterday and said to the Lieutenant General, coordinating it for the Commonwealth, we'll take it. We'll take it. There's no delays here. If there's 60,000 available, they can deliver it today if they want. We will take it. We want more vaccine.
Do you think the average person might shake their head at both sides for kind of
I think the general population should be furious about the politics being played around vaccine supply. The Commonwealth needs to stop playing each state off against each other, accusing us of lagging behind. I've done the stats, I've looked at the figures. We were ahead of New South Wales' vaccination rate in June, before their breakout. And the only reason they've been able to move ahead is because they've been given more supply. Now, we don't begrudge them that, but the Commonwealth has got to stop picking fights, particularly with Queensland and Western Australia. The two states that have the most open economies, have the virus under control, don't have community transmission happening across the state, and yet Scott Morrison seems to be purely focused on Queensland and Western Australia. Why? Why? When we actually got the best results in the country in managing the virus and we're getting on with delivering the vaccine. So, you know, Scott Morrison's got to stop saying we're in this together and then doing complete opposite and popping up his ministers every day to attack us. Are we in this together or not? Queenslanders want us to be in this together. Stop picking fights and just get on with giving us the vaccine.
What should Queenslanders start doing when it comes to travel at Christmas time, seeing families into the state? Should they start making plans now or just put it on ice with the vaccination rates as they are?
We hope to vaccinate as many people as possible as quickly as possible. We don't know when we're going to get enough vaccine to offer every Queenslander who's eligible a vaccine. We don't know what that deadline is. I would love to know, what is that final date? When will we get the critical mass that every single Queenslander who wants a vaccine can get it? I don't know what that date is yet. So that's a question that should be asked of the Commonwealth. I want people to holiday at Christmas. We all want to be able to catch up with family and friends at Christmas time. But we don't know what's going to be happening in New South Wales and the ACT and Victoria with their outbreak. But we have an obligation, and the Premier has said this time and time again, our responsibility is to keep Queenslanders safe. That's what we're doing, that's what we'll continue to do, but our message to Queenslanders, don't wait for the next outbreak. Come and get vaccinated now. Make sure that every dose that we get off the Commonwealth, that we're using, and we're using straight away.
Will Queensland mandate a vaccine for all health workers?
We're looking at that right now. So we have really high rates of vaccination. I'm very proud of our health workers. I believe we're around the 80% mark of our total health workforce have had at least one dose, which is fantastic. But I do want to see this go further, and we're having conversations with stakeholders as we speak.
It's also very quiet at the Brisbane Convention Centre bus hub this morning. Do you know whether all appointments have been taken?
Yes, look, the reason why it's quiet, the reason why you don't see really big long lines behind us is because we had a booking system. People aren't rocking up 1,500 people aren't rocking up first thing in the morning and are having to wait for hours to get in. Everyone's got their booking, they're turning up for their booking, they're going in, they're getting registered, they're getting vaccinated, and they're leaving. So the system works really efficiently. And over 23,000 yesterday. That is a record number. So we are certainly filling those booking slots, but there's more available. So every time there's more supply announced and we get some more, then we will make sure we open up more booking slots. And as the Chief Health Officer said, don't forget you can go to your GP. GPs have got Pfizer as well now, and also community pharmacies who have got AstraZeneca and will be delivering Moderna very soon. So you've got many, many options, and we ask everyone across Queensland, take up those options. Find out where your local vaccination clinic is and go get vaccinated.
Are you in favour of using facial recognition in any form for home quarantine in Queensland?
Look, what we are doing is, and the Premier announced this for the boarding students that are coming back and allowing them to home quarantine, is establishing a new home quarantine check-in system. At this point, there is no facial recognition that would be part of that, but we'll have more to say of how that system will work very shortly, but we're not using the facial recognition at this point.
Just on the vaccine ordering, did the Queensland Government only order 37% of AstraZeneca quota? Because that's being suggested.
I've been talking about this all along. Since June, since the change with the target around the age groups, Queensland Health is concentrating on the under 60s vaccination, and the GPs and community pharmacies are concentrating on the 60 plus. So that's how we've distributed the vaccines and our responsibility, and that's what we're doing. So we've taken on the bulk of the work of under 60s, and the GPs have taken 60 plus and now community pharmacies. But of course now the message is GPs are broadening as well, and that's great because that helps us, and they're taking under 60s for the Pfizer. So,
but you could be getting a lot more AstraZeneca. I mean, that's the bottom line, isn't it? If we're only ordering 37% of our...
Not all the AstraZeneca is being taken up now with GPs and community pharmacies. So it is best that we make sure every drop of Pfizer that's available that the state's taking is getting into the arms of those under 60, because that's the area of responsibility we've taken on. Thank you.
Very quickly, just about the barriers. The Premier was asked yesterday about people hugging and kissing at the border. Are you concerned as the Chief Health Officer about that sort of thing, which seems a pretty regular occurrence?
Well, New South Wales currently has stay-at-home orders in place, except for those 5 reasons that you can leave your home, for their entire state. They have made a risk assessment, and that is their decision. So yes, I am concerned when the New South Wales Government has said that all of their citizens need to stay at home, to see those citizens leave their home for the purpose of simply going out to engage with Queenslanders. I am concerned about that because they are at risk. Now, I do work very, very closely with my colleague in New South Wales, and every morning I get information directly from her about where they're seeing sewerage detections that are new. So at this point we haven't seen positive sewerage in the Tweed Heads, which is good, but we have seen it off and on in Byron Bay. So they'll get new detections and then they'll clear and they'll get them again. Similarly for other parts of New South Wales there and along the border, going Walgett, Burke, further along the border. And that is a concern. It means they've got cases of COVID in their community that they don't necessarily know about. Now, people in New South Wales, if they don't follow those stay-at-home orders, can leave their home and move into Tweed. And we're seeing that happen. So yes, it does concern me. While New South Wales has stay-at-home orders in place, I would really prefer to see that those New South Wales people stay at home.
Peter Dutton just tweeted that you have texted him.
I'll show you the text and the phone call.
Can we see it?
Yeah, I've got it for you.